If you've noticed that your body is producing little to no volume of fluid, you're not alone, and you're definitely not imagining it. This is a real medical condition that affects thousands of men, and today I'm going to explain exactly what's happening in your body and, most importantly, how to fix it. By the end of this video, you'll understand the science behind this issue and have a clear action plan. Let me introduce myself. I'm Dr. Jane, a urologist with over 10 years of specialized experience in male reproductive health. During this decade, I've treated hundreds of men dealing with exactly this condition, and I can tell you that in most cases, it's completely treatable once we identify the underlying cause. My mission today is to give you the medical knowledge you need to address this properly. This video is purely educational about male reproductive health and medical conditions. We're discussing anatomy, physiology, and evidence-based treatments. If you care about your health and want scientifically accurate information, please like this video and subscribe to the channel. Let's dive into the medicine. Understanding the condition. What's actually happening? First, let's get the terminology right. The medical term for absent or very low fluid volume is called aspermia, when there's no fluid at all, or hypospermia, when there's significantly reduced volume. We're talking specifically about the volume of fluid your body produces. Normal volume ranges from 1.5 to 5 milliliters per release. That's roughly a quarter to a full teaspoon. If you're producing significantly less than this, or nothing at all, there's an underlying cause that needs to be identified. Here's what you need to understand. This fluid comes from 3 main sources in your body. About 60 to 70% comes from the seminal vesicles, about 20 to 30% comes from the prostate gland, and a small percentage comes from other glands. If any of these systems aren't functioning properly, your volume drops. The sensation and the production of fluid are controlled by different but coordinated processes. This is why some men can experience normal sensation but produce little or no fluid. The neurological part works, but the production or delivery system has a problem. Cause number 1, retrograde release. This is the most common cause of absent or very low fluid volume, and here's what's happening. Normally, when you reach the moment, a small muscle at the base of your bladder, called the bladder neck sphincter, closes tightly. This closure forces the fluid to go forward and out through the urethra, which is the normal direction. In retrograde release, this bladder neck sphincter doesn't close properly. Instead of going forward, the fluid takes the path of least resistance and goes backward into the bladder. You still experience the sensation normally, but little or no fluid comes out. Later, when you urinate, the fluid mixes with urine and is expelled that way. What causes this sphincter to malfunction? Several things. Diabetes is a major culprit because high blood sugar over time damages the nerves that control this muscle. This is called diabetic neuropathy, and it affects many automatic body functions, including this bladder sphincter. Certain medications can also cause this. Alpha blockers, which are commonly prescribed for high blood pressure or enlarged prostate, specifically relax this bladder neck muscle. That's actually how they help with urination, but the side effect is that they can cause retrograde release. Medications like tamsulosin, alfuzosin, and doxazosin are common examples. Previous surgery on the prostate or bladder neck can also damage this sphincter mechanism. Procedures like TURP for prostate enlargement or bladder neck surgery can affect how this muscle functions. How do you know if you have retrograde release? The telltale sign is cloudy urine immediately afterward. The fluid mixing with your urine makes it look cloudy or milky. Your doctor can also test a urine sample collected right after to look for the presence of fluid components. The good news is that retrograde release isn't dangerous to your health. the fluid in your bladder gets eliminated normally with urine, and your body reabsorbs any components it needs. However, it can affect fertility if you're trying to conceive, and some men find it psychologically distressing. Treatment depends on the cause. If medication is the culprit, your doctor might be able to switch you to an alternative. If it's due to diabetes, better blood sugar control can sometimes improve nerve function over time. There are also medications like pseudoephedrine or imipramine that can help the bladder neck close more effectively, though these don't work for everyone and have their own side effects. Cause number 2, blockage or obstruction. Sometimes fluid production is normal, but there's a physical blockage preventing it from coming out. This can happen at various points in the reproductive tract. And here's something I see constantly in my practice: men who suffer with this for years without knowing there's a solution. The most common location for blockage is in the ducts that transport fluid. These are tiny tubes that carry fluid from the seminal vesicles and prostate to the urethra. These ducts can become blocked by inflammation, infection, scar tissue from previous infections, small cysts, or calcifications. When these ducts are blocked, the seminal vesicles and prostate continue producing fluid, but it can't get out. This can cause a feeling of pressure or discomfort in the pelvic area. Some men describe it as feeling stuck or incomplete. Chronic prostatitis, inflammation of the prostate gland, can also cause reduced volume. When the prostate is inflamed and swollen, it doesn't produce fluid as efficiently, and the ducts can become partially blocked by the inflammation. Previous infections, especially transmitted infections that weren't treated promptly, can cause scarring in the reproductive tract. This scarring can narrow or block the passages that carry fluid. I always tell my patients, treating infections quickly isn't just about curing the current infection, it's about protecting your future reproductive function. Diagnosis of blockage usually requires specialized testing. I typically order a transrectal ultrasound, which uses sound waves to examine the prostate and seminal vesicles. This can show if the seminal vesicles are dilated and full of fluid that can't get out, which indicates blockage. Sometimes an MRI is needed for better visualization. Treatment depends on the location and cause of the blockage. If it's due to active infection or inflammation, antibiotics and anti-inflammatory medications can help. For structural blockages, there are minimally invasive procedures that can surgically open blocked ducts. This is done through a scope inserted through the urethra with no external incisions. Cause number 3, hormonal imbalances. Your body's hormone levels have a direct impact on fluid production. And let me tell you, as a urologist, I'm seeing more and more young men with hormonal problems that used to be rare. The main players here are testosterone, prolactin, and thyroid hormones. Low testosterone is increasingly common, especially in men over 40. Testosterone is essential for the seminal vesicles and prostate to produce fluid. When testosterone levels are low, these glands don't function at full capacity, and volume decreases. Low testosterone also typically comes with other symptoms: decreased interest, fatigue, reduced muscle mass, mood changes, and performance difficulties. Elevated prolactin, a hormone that's supposed to be low in men, can suppress testosterone and directly reduce fluid production. Prolactin elevation can be caused by certain medications like antipsychotics, by pituitary gland tumors called prolactinomas, or by chronic stress and sleep deprivation. Thyroid problems, especially hypothyroidism, where the thyroid is underactive, can also affect reproductive function and fluid production. The thyroid regulates metabolism throughout your body, including in reproductive tissues. The diagnosis is straightforward: blood tests. I always order a comprehensive hormone panel: total testosterone, free testosterone, prolactin, thyroid-stimulating hormone, and sometimes other hormones like LH and FSH to get a complete picture. Treatment is targeted to the specific imbalance. Low testosterone can be treated with testosterone replacement therapy, which comes in various forms: injections, gels, patches, or pellets. It's crucial this is prescribed and monitored by a doctor, as improper use of testosterone can cause serious side effects. If prolactin is elevated, I need to find the cause. If it's medication-induced, switching medications might help. If there's a prolactinoma, medications like cabergoline or bromocriptine can effectively lower prolactin. Thyroid problems are treated with thyroid hormone replacement. It's important to note that testosterone replacement therapy itself can actually reduce fluid volume in some men because it can suppress the body's natural testosterone production. This is why it needs to be carefully managed by a specialist. Cause number 4, age-related changes. Let's be honest about something many doctors don't discuss openly. As men age, fluid volume naturally decreases. This is a normal part of aging, though the degree varies significantly between individuals. And no, this doesn't mean you're getting too old. It's simply biology. Studies show that volume peaks in men's 20s and gradually decreases after age 35. By age 50, many men produce 30 to 50% less than they did in their 20s. 70, the reduction can be even more significant. Why does this happen? Multiple factors. The seminal vesicles and prostate undergo age-related changes in their cellular structure and function. Blood flow to these organs decreases with age. Hormone levels decline. The efficiency of the glands simply decreases. Additionally, as men age, they're more likely to be on medications that affect production, to have underlying health conditions like diabetes or cardiovascular disease, and to have lower testosterone levels. While you can't stop aging, you can slow its effects. Maintaining excellent cardiovascular health through diet and exercise improves blood flow to all organs, including reproductive organs. Keeping testosterone levels in healthy range through lifestyle or medical treatment helps maintain function. Avoiding smoking and excessive alcohol preserves tissue health. Cause number 5, very high frequency. This is a cause that many men don't consider, but I see it a lot in my practice. If there's very frequent activity, multiple times per day, your body simply doesn't have enough time to replenish the fluid. Remember, producing fluid takes time and resources. The seminal vesicles need about 24 to 72 hours to fully refill. If there's new activity before they've had time to replenish, the volume will be significantly reduced. This is particularly common in younger men or when there are multiple occurrences in quick succession. The first may have normal volume, but subsequent ones within a few hours will show progressively less fluid. The solution here is straightforward. Allow more time between occurrences. Most men will see normal volume return if they wait at least 48 to 72 hours. This gives the body adequate time to produce and accumulate fluid. Cause number 6, dehydration and poor nutrition. This is one of the most overlooked but easily fixable causes, and I can tell you, as a physician, I'm shocked by how many of my patients are chronically dehydrated without even realizing it. Fluid production requires adequate hydration and nutrition. If your body doesn't have the raw materials, it can't manufacture adequate fluid. Studies show that approximately 75% of men are chronically mildly dehydrated. When you're dehydrated, your body prioritizes critical functions. It makes sure your blood, brain, and vital organs have enough fluid. Non-essential functions, including reproductive fluid production, get deprioritized. Additionally, production requires specific nutrients. Zinc, selenium, vitamin C, vitamin E, and amino acids are all important for optimal function of the seminal vesicles and prostate. The fix is simple but requires consistency. Drink at least 8 to 10 glasses of water daily. That's about 2 to 2.5 liters. Your urine should be pale yellow, not dark. If it's dark, you're not drinking enough. It's that simple. Eat a nutrient-dense diet with vegetables, fruits, lean proteins, nuts, and seeds. Foods particularly good for reproductive health include pumpkin seeds, high in zinc, Brazil nuts, high in selenium, tomatoes, high in lycopene for prostate health, fatty fish like salmon, high in omega-3s, and dark leafy greens. Avoid excessive alcohol, as it's both dehydrating and can directly suppress testosterone production. Limit caffeine, as it's a diuretic that increases fluid loss. Cause number 7, medications and substances. Many medications and substances can reduce production, and most men have no idea this is happening. I always review my patients' complete medication list because this is often the obvious culprit that nobody noticed. We already mentioned alpha blockers for prostate or blood pressure. Other common culprits include certain antidepressants, particularly SSRIs, which are widely prescribed. These can affect various aspects of reproductive function, including volume. Finasteride and dutasteride, medications used for hair loss and prostate enlargement, reduce DHT, a form of testosterone, and can decrease volume. Some men on these medications notice significantly reduced volume. Antipsychotic medications, some blood pressure medications, and even certain antihistamines can affect production through various mechanisms. Recreational substances also have major effects. Use of certain substances, particularly heavy or chronic use, can significantly reduce volume and affect reproductive hormones. Excessive alcohol chronically suppresses testosterone and directly damages tissue. Steroids used for bodybuilding shut down the body's natural testosterone production and dramatically reduce volume. If you're on prescription medications, never stop them without talking to your doctor. However, you can discuss with me or your doctor whether alternative medications might have fewer effects on reproductive function. Diagnostic testing. What I check in my patients. If you're experiencing low or absent volume, here's what proper medical evaluation should include. And this is exactly what I do in my practice. First, detailed medical history. I need to know all medications you take, including over-the-counter and supplements, your medical conditions, especially diabetes, previous surgeries, your symptom pattern, when it started, whether it's getting worse, associated symptoms. Second, physical examination, including examination of the reproductive organs, prostate assessment, and checking for signs of hormonal imbalances. Third, laboratory testing. This should include comprehensive hormone panel with testosterone, prolactin, thyroid function, blood sugar testing to check for diabetes. Fourth, specialized testing if indicated. Post-release urinalysis to check for retrograde release, transrectal ultrasound to visualize prostate and seminal vesicles, analysis to assess what fluid is produced. Don't accept it's just stress or it's normal aging without proper investigation. While those can be factors, they're diagnoses of exclusion, meaning you need to rule out treatable medical causes first. Comprehensive treatment and solutions. Now let's talk about solutions, and here's where it gets interesting because treatment must be completely tailored to the underlying cause. For retrograde release, if caused by medication, let's discuss alternatives. For nerve damage related to diabetes, optimize blood sugar control. Maintaining HbA1c below 7% can prevent further damage. Specific medications can help the bladder sphincter close better. For blockages, we treat any underlying infection or inflammation with appropriate antibiotic and anti-inflammatory therapy. We consider intervention if structural blockage is confirmed. We maintain prostate health with good hydration, anti-inflammatory diet, and regular physical activity. For hormonal issues, if testosterone is low, we work together to optimize levels. We address prolactin elevation by treating the underlying cause. We treat thyroid dysfunction with appropriate hormone replacement. For age-related decline, we maintain excellent cardiovascular health through regular aerobic exercise, at least 150 minutes per week. Strength training 2 to 3 times per week helps maintain testosterone levels. We eat a Mediterranean-style diet. We maintain healthy body weight. We ensure adequate sleep, 7 to 8 hours nightly. We manage stress. For high frequency, we space occurrences to allow 48 to 72 hours between for complete replenishment. For hydration and nutrition, we drink 8 to 10 glasses of water daily. We eat zinc-rich foods, pumpkin seeds, oysters, beef. We include selenium sources, Brazil nuts, fish, eggs. We consume antioxidant-rich foods, berries, leafy greens, tomatoes. Supplements, what actually works. Let's talk honestly about supplements. As a physician, I get a lot of questions about this. Supplements with some scientific support include zinc, 15 to 30 milligrams daily, most effective if you're deficient. Selenium, 200 micrograms daily, easily obtained from 2 Brazil nuts. L-arginine, 3 to 5 grams daily, improves blood flow. L-carnitine, 1 to 3 grams daily, supports cellular function. Omega-3 fatty acids, 1 to 2 grams daily, powerful anti-inflammatories. Vitamin D, based on blood test results. Many men are deficient. Important warning, the supplement industry is poorly regulated. Choose quality products from reputable manufacturers with USP or NSF certifications, and always discuss with me or your doctor before starting any supplement. Lifestyle modifications that make a real difference. These are the recommendations I give all my patients, regardless of the cause. Exercise regularly, 150 minutes of moderate aerobic activity weekly, plus strength training 2 to 3 times per week. Maintain healthy weight. Even losing 5 to 10% of body weight can dramatically improve hormonal and reproductive function. Quit smoking. There's no way to sugarcoat this. Smoking destroys blood vessels and reproductive tissue. Limit alcohol. Maximum 1 to 2 drinks daily. More than that, chronically suppresses testosterone. Manage stress, meditation, yoga, deep breathing. Chronic stress damages testosterone. Optimize sleep, 7 to 9 hours nightly. Testosterone is produced during sleep. Avoid excessive heat to reproductive organs. No prolonged hot baths or laptops on your lap. Practice pelvic floor exercises. Male Kegel exercises strengthen muscles that support prostate function. When to see a doctor immediately. As a urologist, here are the warning signs that mean, come see me now. Seek immediate attention if you experience sudden complete absence when it was previously normal, especially if accompanied by pain, fever, or inability to urinate. Blood in urine always requires immediate investigation. Severe pelvic or lower back pain along with volume changes, fever, chills, or signs of infection. Sudden symptoms of very low testosterone, extreme fatigue, severe depression. For non-emergency situations, schedule an appointment within a few weeks if you notice sustained reduction lasting more than 2 to 3 weeks or any progressive changes in patterns. The psychological aspect. Let me be completely honest with you. Many of my patients experience significant psychological distress about this condition. Some men come to my office worried, thinking they've lost something important or that there's something fundamentally wrong. It's important to understand that volume doesn't define your masculinity, your worth as a partner, or your ability to have satisfying relationships. This is a medical condition, not a judgment of your character. If you're experiencing psychological distress, anxiety, depression, self-esteem issues, please consider talking with a therapist experienced in men's health issues. There's no shame in that. Mental health is health. If you're in a relationship, open communication with your partner is absolutely crucial. Share what you're experiencing and that you're seeking medical treatment. In my experience, most partners are far more understanding and supportive than men fear. Often, the anxiety about the condition causes more relationship problems than the condition itself. The final conclusion. Reduced or absent volume is a real medical issue with multiple potential causes. The good news, and I emphasize this to all my patients, is that most causes are identifiable and many are completely treatable. The key is proper medical evaluation by a urologist or men's health specialist to identify the specific cause in your case. Don't self-diagnose based on internet information. Don't rely on miracle supplements without medical guidance. Come see me or see a urologist in your area. While you pursue professional evaluation, you can immediately implement the lifestyle changes we discussed. Better hydration, improved nutrition, regular exercise, stress management, adequate sleep. These changes will benefit your overall health, regardless of the specific cause of your issue. Remember that some degree of age-related decline is normal and expected. The goal isn't necessarily to have the same volume you had at age 20. The goal is to optimize your health and function for your current age and to identify and treat any correctable medical problems. If you found this educational video valuable, please like and share it with other men who might benefit from this information. Subscribe to the channel for more evidence-based content about men's health and topics that aren't discussed enough. Remember, your health matters, these are legitimate medical conditions, and seeking proper medical care is a sign of intelligence and self-respect. Take care of your health, be proactive about seeking proper evaluation, and don't suffer in silence with something that may well be treatable. A hug and see you next time.